Yes, good evening, ladies and gentlemen, and the gallant viewers of Satellite TV. You're all most welcome for this evening's session once again on Satellite TV. Endometriosis, we have learned about many other conditions. Yet today we have also come with another disease, in brief, PID. It is the most common condition that is affecting us. At least 80% of women who come to us for treatment with the complaints related to lower abdominal pain and back pain, we ended up discovering that they are suffering from PID. And that makes it necessary for us to treat this as a medical burden, and there is need for us as Satellite TV to bring this to us, to our attention, so that we can be able to have cautions against this burden. Gave us that we should not necessarily be unwell health-wise, unwell when it comes to finances. We should be economical well, we should be physical well, we should be psychological and economical, we should be well. Therefore, if this health burden takes away money from your pocket, it is therefore a necessity for us at least to have this discussed with you so that you can take caution. What do we understand by the abbreviation PID? PID, in my definition here, stands for pelvic inflammatory disease. Pelvic inflammatory disease. This is a condition that affects nearly almost a good number of ladies who come to us, just like I said earlier on, with complaints of low abdominal pain and back pains. It affects them, and the causative organisms or microbacteria is basically bacteria and chlamydia. These are the two bacteria or the organism that causes the PID. And what are the risk factors that makes someone to get the PID? One of them is actually untreated STIs, sexual transmitted infections. If this is not treated, primarily it affects the lady, and this will be able to make her develop that low abdominal pain. At the end of it all, she developed the PID. Two, we look at multiple sexual partners. In multiple sex partners, you will find that a lady who shares a good number of men sexually will end up acquiring different types of bacteria in her body, and this bacteria includes the gonorrhea and chlamydia. And once this one enters her body, obviously she will be able to start developing the signs and the symptoms of pelvic inflammatory disease. So therefore, caution has to be taken. Unsafe medical procedures. You know, there are very many facilities that have come on board, and some of them do not give out standard treatments or treatment which is aseptic. They end up giving quick services, and because of that, you'll find that instruments that are used to examine a lady vaginally, this lady may end up being checked using instrument that is not sterile, and then she ends up getting infection from the medical equipment, which is supposed to be a sterile procedure. Because of that, the lady will be able to suffer from what? The PID, and it is acquired from the what? From the hospital. And the next thing I want to talk about is vaginal douching. This is a process a lady does by solutions which are chemicals which are stronger, and they end up disorganizing the normal vaginal bacteria, that is the normal flora, from doing its work of protecting the vagina. At the end of it all, once the normal flora drops in numbers, and then you find that harmful bacteria ends up moving upwards, multiplies and moves upwards into the uterus, and then into the fallopian tubes. Later on, maybe it will end up to what? The ovaries, hence causing what? The pelvic inflammatory disease, what I was talking about. Therefore, after saying this, one has to take cautions about it so carefully. What are the key symptoms, or what risk factors one has to take, or what are the, let me just say, signs and symptoms? What are the signs and symptoms one has to see into this person so that you can take an action? Some women experience no symptoms at all, making routine screening essential. This is my word I am giving to you. You always don't have to wait for signs and symptoms to first come before you can actually take an action. When you are healthy enough, if you are cautious about your health, it would be good for you to come to a doctor and request for screening. Someone has to listen to you, necessary tests has to be done so that you are screened out for PID. However, when you begin to see these signs on yourself, you have to be very, very careful. Number one is pain. Where is the pain located? The pain we are talking about here is on your lower abdomen. When you start seeing pain on your lower abdomen or at the pelvic region, you should take caution. You could be suffering from PID. So therefore, any pain that is located on your lower part of the abdomen, please take caution and go to doctor for your screening. You can as well start to begin to feel that pain. Obviously, a step has to be taken. This is on a serious note. Ladies, I am cautioning you on this matter. Another thing that I need to talk about is discharges. This lady will begin to have abnormal vaginal discharge that may have unusual color or foul odor or smell. Now when you see that a normal fluid from a lady's body or vagina is colorless, clear fluid, and it does not smell, and that is a normal fluid that comes from a lady's what? Private part, that is the vagina. And once you begin to see that the fluid that is coming from your vagina or on your reproductive outlet, you should be aware that what? Something is wrong. You should take caution on it. I'm therefore encouraging you, once you begin to see this coming out, please take caution. When the fluid that is coming out is whitish, sometimes yellowish, sometimes greenish, and it smells very badly, sometimes as if there's rotten fish that is on your body, please take caution, ladies. Go for screening. The doctor should be able to screen you on that. 3. When you have uncontrollable bleedings, it comes and goes, comes and goes. These bleedings can be irregularly between your periods, or it can be during sex or after sexual intercourse. Once you begin to start seeing this bleeding, abnormal ones, take caution, meaning that something is happening inside your body. Uterus, cervix, fallopian tube, mention them. Something is happening there. Therefore, you cannot see it with your naked eyes until when you are screened. I therefore encourage you to come to Ansi Medical Center or to any other facility so that you can be screened and you are treated. The good news is that this is a treatable condition, by the way. It is treatable. Once you come, we will be able to help you and treat you up. The first thing I wanted to emphasize on is discomfort. Discomfort is pain or burning sensation during urination or during intercourse. When you are having sex, sex is supposed to be enjoyable. You are supposed to enjoy sex by the time you begin the system. Therefore, in and out movement of penis ends up causing injury to the internal organs, and therefore you will begin to feel pain. Therefore, I encourage you to go and screen yourself. You are supposed to urinate normally without pain. Now, once you begin to feel pain when you are passing urine, that means you are having wound on your reproductive system outlet here. So therefore, you have to go and screen yourself before it is late. Last one is systemic side. Now moves. When I talk about systemic, it is now movement of this infection in the blood circulation. Now it moves to all parts of the body. And how will you know that it is already spreading to the all parts of the body? One, you will be able to see that what your body temperature goes up. That is what is known as fever. Sometimes the body temperature drops. You feel cold. Sometimes you feel like vomiting, and yet you cannot vomit. Sometimes you feel severe acute chest pains. So therefore, these are indications that you are not doing well sexually. So therefore, you have to take precautions. I would like to bring our attention to my fourth point that I want to raise here. Why early treatment? Why do you have to carry on treatment early? If left untreated, if this PID is left untreated, my sister, my mother, my daughter, this can turn out to be a hazardous thing. It will cause a wound in the reproductive tract system, starting from the cervix. It goes to the uterus. When it is at the cervix, you can easily get a cervical ulceration, and then when it enters into the uterus, you can suffer from endometritis. When it goes into the fallopian tubes, you have what is known as salpingitis, and then once it enters in the ovaries, it creates more havoc. You suffer from ovulitis. Why would we treat this early? To avoid these problems I've been mentioning here from occurring. Failure to do this, it leads into infertility. How does that one come about? Once this bacteria moves upwards, it keeps on causing havoc in the system where it is passing by creating wounds. And then once these wounds they have healed, it leaves scars, narrowing the opening of the fallopian tubes, blocking the ova or the egg of a woman from moving from one side to the other to meet the sperm where the blockage has occurred. Once it has blocked the sperm from crossing to the other side of the where the fertilization will take place at the neck of the uterus, then you are definitely not going to conceive. Probably you will wonder, who is bewitching me? Who is doing this? What have I done wrong? You even visit all these pastors and imams and that sects to pray for you. I am telling you the truth, you will never conceive until you are helped medically. So therefore, it is a very dangerous condition that most of the women who are actually complaining of what infertility actually suffers from PID before, and it has caused that blockage on the fallopian tubes. That makes it very necessary for you to seek medical advice. Even when you are feeling you're okay, go and screen yourself from PIDs so that you don't get shocked or get perturbed when you are diagnosed with that condition at a later stage when it has already caused damage into your reproductive system. Sometimes those women who by chance the sperm maneuvers itself and move across and fertilize the egg, this lady ends up having the baby conceived outside the uterus, what is known as what? Ectopic pregnancy. This means this pregnancy is going to happen at the fallopian tube, meaning that this tube cannot be able to accommodate this pregnancy up to 9 months. By the end of 28 weeks, this fallopian tube is already overstretched, and if you are not helped, it will burst. Once it bursts, you begin to bleed internally, your hemoglobin level drops. Sometimes now you even faint. Once you faint, the first thing we shall be able to see is that you are getting cold, you are dying, because you have lost a lot of blood internally. Therefore, it is not a very good thing to have an ectopic pregnancy, and that's one of the danger things that makes this condition a serious matter for you as a lady. I am cautioning you, those ladies who are watching Satellite TV and who are listening to me, please, this is one of the danger things that I encourage you to take cautions about. One of the things that I would like to bring about is chronic pelvic pain. Chronic pelvic pains mean that you are always living in pain. Any small thing that touches the uterus inside there through your vagina, you're already feeling pain. When you are about to menstruate, you're already having pain. Even any small work that you do that made the stomach to bend down a little, you are going to have the pain. And that pain of yours is just going to be a very long one. It is going to be for a long time. And you will be visiting every facility to change painkillers, one to another, and this is a very dangerous thing for you as well when you overtake the painkillers. So therefore, it is always very good for you as a lady to go and screen yourself over this condition, and it will be able to help you in advance. What should we have to take as a precaution, as a preventive measure? Or number one thing is medical care. PID is treated. Once you come earlier on, it can be treated. We will treat you very well, and ANSI Medical Center is one of the facilities known, approved to have these conditions treated, and we have very many success stories in coming in regard to that. And this is actually one of the things that made us as ANSI a unique facility for you to visit with such conditions. Once we treat you, even those who have failed to conceive, thereafter they conceive, we will be able to even monitor them until at the end when they have delivered, and even monitor their baby for 3 months, and then there we can be able to say, okay, you are now fine. So therefore, I encourage you to seek medical attention as quickly as possible once you have started feeling those pains. So prescriptions I can't be able to give you, it is us who knows it. But the truth of the matter is, it is a condition that can be treated. Please, once you are being diagnosed with PID, it is advisable that you make your partner treated as well. Say for example, your partner you will get treatment and your partner does not get. He acts like a reservoir. A reservoir is actually when you have people, those who have actually those who have done plumbing, you know a reservoir is a place where you keep a reserve water to be used at a later time. So that person will act like a reservoir to keep the bacteria for you, the chlamydia for you, so that after the treatment, when you go and sleep with this person again, you are again going to contract the same sickness. and then you will just be constantly in pain. And in the treatment procedures, we always encourage that you bring your partner so that we can be able to treat your partner alongside you, so that the infection is eliminated once and for all. And if your partner also have got other sexual partners, please, all of them should get treated, because research says that sex is addictive, and there's no way out. We will stop that person to going to the other person to have the sex with that person. Therefore, encourage your partner to come for treatment, and if there are others, let them be treated so that the infection gets out of you once and for all. When you are doing the treatment, I will always encourage you to abstain. Please abstain. If you cannot abstain, I will encourage you to come to us. We shall provide for you quality protection, that is by the use of tested and trusted condoms that we have here. We have got variety of them, range of them, ranging from classics, going to kiss varieties. We go to even the lifeguards, mention them. There are very many out there, but we shall be able to give you the one we know is quality, that will be able to protect you. That means if you cannot abstain during the treatment days. So therefore, that is very important. I therefore want to caution you on these habits. These habits, when you do them, please, it will be of help to you. 1, you should consistently use condoms. If you are someone who is sexually active and you doubt your partner, use condoms. But if you cannot trust only one person and you always do routine checkups with this person, good for you. I will say that one is okay. And then do regular STI screenings. STIs are conditions which you get them, diseases that you get them when you sleep with someone who has the infection. For example, someone who has gonorrhea, if you sleep with that person, of course you will get the gonorrhea. Someone who has syphilis, if you sleep with that person, you will get it. HIV, you will get it. Even hepatitis, you will get it when you sleep with someone who is sick. Therefore, doing the screening of these conditions regularly will save you from suffering from PID in the long run. Another thing that I want to talk about is avoid vaginal dodging for ladies. Please, ladies, avoid that as much as possible, because if you continue to do this, you hear about it. People are saying that you use Coca-Cola to clean yourself inside there, it will be able to help you. You use Pepsi, you use that chemical. These are very wrong practices, and it reduces the acidic level of the vagina. Once it is the acidic level is down, obviously it gives rise to the bacteria which are harmful to grow, and they will accelerate upwards into the uterus and then to the fallopian tubes up to the ovaries. Therefore, it is advisable that you should be able to avoid this kind of practices. I know for some cultural beliefs people do that. Others believe that when you do that dodging after sex, you avoid pregnancy. Those are your beliefs, but I'm not encouraging you to do them for the safety of your future. Another thing is now seek prompt medical attention for any sexually, vaginally discharges that you are seeing coming from your vagina. Don't just be judgmental to yourself, or don't be shy that I am going to start talking about this to a doctor, to a nurse. That is your right as you yourself, your health right. You are actually compromising it. I encourage you, please, to come to us. We shall be able to help you. We will help you professionally, because we are all trained to handle you in a manner that you will be able to help yourself in this. Otherwise, thank you very much. I still remain Dr. Philiam, the director of ANSI Medical Center, at the same time also the chairman of private health facilities for West Nile. I encourage you to come to ANSI Medical Center or go to any nearby health facility that you can believe in, that can be able to run for you I don't know what it